Good afternoon, everyone. We're really pleased that you've joined us today for our community engagement webinar, and this will explore the key findings from Citizens Panel 9. So a very warm welcome to you all. So today you'll hear from a number of speakers, both from the Community Engagement Directorate within Healthcare Improvement Scotland and from our colleagues from the Scottish Government. My name is Wendy McDougall. I'll be the host for today's webinar. So without further ado, I'm going to ask each of our speakers today to come in and introduce themselves too. And Gary, you're first on my screen, so if I can ask you to come in first.
Thanks, Wendy. Hello, everyone. I'm Gary McGraw. I'm a social researcher with Healthcare Improvement Scotland's Community Engagement Directorate. I've been doing a lot of work on the Citizens Panel down the last few years.
Thanks, Gary. And Louise? Can I just get to Joy in the meantime?
Hello, good afternoon. My name is Joy Van McCarris and I work with Gary McGraw on the Citizens Panel.
Thanks, Joy. I'm going to go to Murray, if Murray's here at the moment.
Hi, Wendy. My camera's been disabled.
Oh, okay. All right, we'll get our tech support.
Oh, there it goes. There it goes.
Yeah. That's great.
Yep. Hi, everyone. I'm Murray Steele, and I sit within the Inclusive Vaccinations team in Vaccine Strategy at the Scottish Government. So yeah, I had some questions in Citizens Panel 9, which we'll be talking about. Thank you.
Thanks, Murray. And Louise, I'm not sure if Louise is maybe having issues with her camera or mic as well. Or...
Hi, Wendy. Sorry about that. Yes, I have been having issues. So nice to see everybody. I'm going to be chatting to you about the results, obviously, of Citizens Panel 9 survey. I'm Senior Policy Manager with the Scottish Government and I look after participation. So I'll be chatting a wee bit more about that. And again, sorry for the communication problems.
That's excellent, Louise, and looking forward to hearing all about it. So if I can provide you with a brief context to this webinar today, and then we'll hear from our first speakers. So today's webinar will provide insight into how the National Citizens Panel for Health and Social Care works. As I say, you'll hear about recent findings from the 9th Citizens Panel survey. This particular survey focused on the topics of public engagement in health and social care service design and change, COVID-19 vaccination programme inclusion and COVID status certification. Scottish Government policy leads will also cover how they plan to use the findings to shape national health and care policy and services. So just to say that there'll be a brief Q&A session in between each presentation today, of which we have 3. And then if there's time at the end, we can open up for a wider plenary and question and answer with all the speakers for the webinar closing at 3 o'clock or maybe slightly before. I can give you that gift of time. For those of you who'd like to ask your speakers any questions, please post these in the chat or any reflections that you may have throughout. These will be picked up by my colleague Sharon, who's kindly monitoring the chat box today, and we'll cover these either in the brief Q&A or at the wider one at the end. Feel free to raise your virtual hand rather than posting your question in the chat when each speaker opens up their presentation for questions as well. And there'll also be relevant links posted in the chat as we go through the presentation. So again, without further ado, if I can just pass over to Gary and Louise for the first presentation of today.
Thanks, Wendy, and thanks everybody for turning up to this webinar. It's great to be here and to chat about the Citizens Panel and the work we've done very recently. So I'll talk briefly about the Citizens Panel, the background to it and how it works very briefly, and then I'll talk about some of the results on the public engagement topic, and Louise will then finish up with how those results are going to get put into practice, so to speak. So we'll just start with the background and the context. The next slide, please. Thanks, Stu. Yeah, so our Citizens Panel was established in 2016 to be nationally representative and has been developed at a size that allows statistically robust analysis of the views of panel members at a Scotland-wide level. And it's established to gather a public view on topics specifically. This was the first time a national Citizens Panel of this nature, focusing on health and social care issues, has been established in Scotland. Panel members were randomly selected from the general population and invited to join the panel. Some targeted recruitment took place to ensure that it's a representative panel. And so currently there's roughly about just over 950 panel members from across all 32 local authority areas. And the panel is broadly representative at a national level across many demographics, including sex, age and deprivation. Our survey feedback is collected via electronic survey, postal survey and telephone interviews, and that's according to panel members' preference. And we aim for the data for the survey to be accurate to plus or minus 5% error level. So it's robust at the overall panel level, and our response rates are typically over 50%, sometimes much more than that. So moving on to past topics and impact. So these sort of graphics give you a wee flavour of some of the topics that we've had on the Citizens Panel. We've had over 30 topics in our time here. Some of these topics have included things like social inclusion, digital healthcare, awareness of HIV and shared decision making. More recently though, we've got feedback on people's experiences for healthcare services during the pandemic, what matters to people around remobilising services, as well as the topics that we're going to start talking about today. So next slide. These topics have helped inform a lot of pieces of work. The work of the panel doesn't actually end with the publication of survey findings. When we accept a topic commission, there's an agreement with topic sponsors that they will provide feedback about the usefulness and impact of the survey, indicating how they've used to shape, inform and improve their work. And this is a practical use and a core condition of the Citizens Panel. So being able to demonstrate the impact to panel members is really important to us. It lets them see how their views are helping others work towards a healthier Scotland. And we give feedback to our panel members on a regular basis, feedback on the results of the surveys, as well as feedback on the impact that they've made as well. Previous surveys have gone on to inform policy documents that I've highlighted here, published in reports in the media, and used to inform policy recommendations and service improvements as well. So just briefly, I'll quickly go over the Citizens Panel process before I go into the actual survey results. So we run 2 surveys a year, roughly around about June and November. We've established a new way of working in close collaboration with the Scottish Government. They've supported us with longer term planning, and that ensures that topics are timely and follow Scottish Government priorities and can influence policy as well. The topics are generated from policy leads within the Scottish Government, and we sometimes have one topic, or we'll have multiple topics on the survey. The questionnaire is then developed with myself and Joy in community engagement and the topic sponsors in Scottish Government. And our colleagues in our community engagement offices across Scotland help us user test with members of the public. So we test the survey before sending it out to the Citizens Panel. And we have a research contractor and research resource. They do the admin work, the field work, the analysis and the reporting. And when it comes to reporting, we draft conclusions and recommendations in conjunction with the policy leads in the Scottish Government. And we then publish our report on our website, disseminate that through social media and webinars such as this. And we then feedback to panel members as well, close that feedback loop. And once that's done on a regular basis, 6 months, 12 months and 18 months level, we'll go back to the Scottish Government sponsors and ask what they've done with the survey, how it's impacted on the policy and the policy team and the policy work as well to track impact and evaluate the panel. So that's how the Citizens Panel works in a very brief nutshell. If we go on to the actual Citizens Panel 9, so the fieldwork for this survey was undertaken January to April this year. The report was published just recently in July there on those 3 topics that we've mentioned, and the survey received over 500 responses by post, email or telephone, which results in a 53% response rate and is robust at the national level. So in terms of the public engagement topic, the topic came about because there's going to be a review with Planning with People, which is community engagement and participation guidance for health and social care. So that provides community engagement and guidance for boards, integration joint boards and local authorities that are planning and commissioning care services in Scotland. So that guidance was published back in March 21 and is co-owned by the Scottish Government and COSLA. And these findings are actually going to help with the review of that piece of work. We'll just go on to some of the results now. The first question we asked on this topic was about the awareness of the right to get involved. So we asked, are you aware that the people across Scotland have the right to get involved in the design and delivery of new health or social care services and to comment on changes to existing services? And that was beyond giving us feedback through the Citizens Panel. So we omitted the feedback in the Citizens Panel. So we were specifically asking Citizens Panel members whether they knew about the awareness to get involved in health and social care change and design. Just under a quarter actually said yes. The vast majority said no, they weren't aware of it. Over 6 in 10, about 15% were unsure. We did ask those that said yes how they found out about the awareness. Some people found out online about the awareness of of public involvement, some through their work, some through press and media. Some people found out through posters and awareness-raising events. Some had actually been invited or involved in consultation around public involvement, and some people from word of mouth. So I'm not sure how that was a benchmark done just this year. I'm not sure how that would have panned out if we'd done this before the pandemic. Maybe it would have been higher. I don't know, but it's starting to, I would feel a wee bit of a low base there in terms of the awareness of the right to be involved. Next slide, please. We then asked about over the last 3 years or so, covering just before the pandemic, whether people had been asked to give feedback or opinion on service design or change in their local health and social care settings. And just over 1 in 10 actually said yes. The vast majority said no, so quite low numbers there. In terms of the method of involvement, we asked, it was only 50 people that responded back, but in terms of the method of involvement, the most common ways of being involved was by responding to an online survey, 66%, followed by a postal survey, and then a discussion group or focus group in person, which came out quite low, about 1 in 10 of those people that said yes. Moving on to the experience of engagement. So how would you rate those engagement? So this was only asking those people that had actually been involved in engagement, so it's quite low numbers, so there's only 50. So we asked, overall 45% said that their experience was either very positive or positive. Just over a third said it was neither positive or negative. And about 2 in 10 said that their experience was negative. So people were asked why that was. So for those that gave a positive experience, the fact they actually got a chance to give their views, they felt they could make a difference, or the consultation or engagement process went well, was easy to respond to and take part in. These were all the reasons why people felt positive about their engagement experience. For those that found the experience negative, the response was they hadn't seen any changes as a result of the engagement, or they don't know the impact of the input. They also noted difficulties or felt it could be easier to take part in. So these were the reasons why people responded negatively to their experience of that engagement. And the final question we asked was what matters most about being involved. I thought this was quite an interesting question. So what would matter to you most about being involved in the design of the new health or social care services or changing existing services? And we asked people to tick 3 things that matter to them most. So the highest responses were being able to improve local services was a motivating factor, knowing that your feedback could lead to change and informed decision making, having a say on health and social care issues that matter to you. These were all the sort of highest, and then some sort of practicalities about access, such as location, opening times and transport came out quite importantly. Knowing that views and experiences matter, knowing that how you can be involved, so again a bit about the process, a bit about inclusivity, how you can attend meetings and so on. And then finally, certainly not forgetting the feedback, receiving feedback and the impact of their contribution was quite important. So what that says is that people are prepared to engage because they value the opportunities that arise. They can improve local services and have a say in informing decision making. So that's the motivating factors for people to get involved in engagement. I'll just finish up by saying briefly about some recommendations that came out of the results of this on the next slide. So as a result of this, we make the following recommendation to the Scottish Government, NHS boards and health and social care partnerships and local authorities, basically to incorporate the findings of the survey into the review of planning with people, and Louise will talk about that. To continue to developing existing strategies for public engagement, to encourage all communities to participate in health and social care design. That includes raising awareness of the public's right to get involved, informing the public about proposed changes throughout the engagement process, providing feedback on the results or the impact of the engagement to those that took part as well. And there's a recommendation for Healthcare Improvement Scotland community engagement to work collaboratively with partners to develop training opportunities for staff to increase confidence when involving people. These recommendations are a work in progress at the moment. I'll now hand you over to Louise, who'll talk a wee bit more about how she's going to use those findings for planning with people. Louise.
Gary, thank you very much indeed. It's really nice to be here today, both as a Citizens Panel participant, more on that in a moment, but also as the Scottish Government policy lead for participation, which includes sponsoring and supporting Healthcare Improvement Scotland's Citizens Panel. So it's going to come as no surprise to you that I've got nothing but good things to say about Citizens Panel, because for policy teams working within health and social care, the panel's value cannot be underestimated. For researchers and policymakers, being able to access national data on a specific project or a piece of work can really help to inform decision making and deliver better outcomes. Why? Because Citizens Panel reflects the national picture, the opinions of the people living in Scotland. So let's find out why it's important to gain a better understanding of the public's views and why we as a team turned to Citizens Panel. So Scotland's national and local governments are committed to improving the ways that individual people and of course wider communities can be involved in decision making that affects them. Nowhere is that more vital than when it comes to the development of health and social care services that we all rely on. Listening to the views of people who use services and actively involving them throughout the process of planning care delivery is a key improvement recommendation of the recent independent review of adult social care in Scotland, which of course we know as the Feely report. So off the back of that recommendation by Derek Feely came Planning with People. It's co-owned by Scottish Government and also COSLA, and has been produced in partnership with Healthcare Improvement Scotland and also the Care Inspectorate. But what is Planning with People? What does it do? And more importantly, what does it aim to achieve? Well, Planning with People, community engagement and participation guidance, to give it its Sunday name, promotes real collaboration between NHS boards, integration joint boards and local authorities. It sets out the responsibilities that each organisation has to community engagement when services are being planned or changes to services are being planned, and it supports these organisations to involve people in a meaningful way. It's currently in draft form, but nevertheless, Planning with People is the go-to document for engagement professionals who are involved in health and social care service design and change. But before its final publication in the spring of next year, it's being reviewed to ensure that it supports the human rights approach and is aligned to the recommendations in the Feely report. We realise that before carrying out a wider consultation involving specific groups and organisations representing health stakeholders and also groups representing protected characteristics, that we wanted to establish the national picture. First of all, what is the wider public's view on engagement? Well, we can talk about the value of community engagement till the cows come home, but on a practical level, what does it mean to people who have to depend on vital health and care services? Do people know they have a right to be involved and to have their voice heard? This is where Citizens Panel offered us a unique insight into these really important questions, and the results were perhaps not that surprising. 23% of people questioned know that they have a right to be involved in the design and delivery of services and to comment on changes to existing services. But more importantly, 62% said they were not aware and 15% said they weren't sure. So to strip it back, and the results of Survey 9 tell us that people want to be involved in health and social care service design or change. They do want to comment, they want to have their voices heard and to know that they're making a difference. However, much more work needs to be done to make sure that this happens. But the information gathering doesn't end here. In addition to the panel results, we can now take this further and use the data to benchmark more detailed research. As part of the review of planning with people, we've just carried out 2 separate consultations with the NHS and health and social care service providers and the people who use these services. Consultations have now closed and I'm pleased to say we've had a good response. This month will be spent analysing the data, so my apologies for not being able to share it with you today. However, what I can share with you is that just over half of all service users that we heard from in the consultation said that they were aware that they did have a right to be involved. So as we begin the analysis, I think that's a pretty good place to be. And it's going to be fascinating to discover what else the data suggests. So service providers and service users, 2 distinct groups, 2 distinct questionnaires, but with one overarching ambition: to evidence what more needs to be done in terms of raising awareness about engagement, what it is, how to do it, and how to make it more meaningful. Following the survey, we're recommending to Scottish Government, NHS boards, health and social care partnerships and local authorities that they incorporate the findings of the national survey into the review of planning with people, that they continue to develop existing strategies for public engagement to encourage all communities to participate in health and social care service design, including raising awareness of the public's right to get involved in the design and delivery of new health and social care services. So in summary, fundamentally, good engagement means that services are developed which are effective, safe, value for money, and meet individuals' needs. And there is no doubt that greater participation brings better outcomes for communities all round. As a team, we have really enjoyed being part of Citizens Panel 9. It's been a really collaborative process. I can't say anything negative about it at all. My sincere thanks to Gary and Joy for all their support. And I'm pleased to say I have learned quite a bit about research in the last few months. Back to you.
That's fantastic. Thank you so much, Gary and Louise. They are extremely interesting. And yeah, I'll also give that shout out to Gary and Joy as well. The wealth of topics covered by the Citizens Panel, just seeing that within the visual is really quite astounding. And fundamentally, you know, we can see the positive impact it's having in terms of shaping our health and care services. And Louise, we are absolutely delighted to welcome the Planning with People guidance as well, and how that feedback from Citizens Panel 9 has supported the shaping of this going forward. Sharon, I'm going to pass to you. I see there's a number of questions posted. I know that Gary's answered one of these, however, but again, please raise your virtual hand if you'd rather ask your question.
Thanks, Wendy. Una has asked, were people with communication difficulties included in the surveys?
Yes, they are included, very much so. We have reached out to umbrella organisations who have then corresponded with their own members on that particular protected characteristic group. So please be assured that that has very much been taken into consideration. Not in Citizens Panel 9, because I think, as Gary was saying,
just in terms of the Citizens Panel, there are some, yes, and those are the people that receive a telephone interview if they have communication difficulties. And I think there's at least one person that uses BSL as well. And there is the opportunity to have alternative formats used as well within the service.
Thanks, Gary. Louise Whelan's put just a thought rather than a question, and she wonders if the pandemic would have affected the figures on people who were affected, who were asked to give their feedback and comments over the past 3 years. So the impact of the pandemic on the number of people that have been asked.
It's difficult to say, but it may well be the case. I think there was probably less engagement going on during the pandemic, it would be fair to say, particularly face-to-face anyway. So that might have resulted in some of the low figures that we saw. I'm not sure.
Thank you. You'd already answered Stephen's question about why there's no more than 2 surveys a year, but Claire is asking if you could maybe give a little bit more about your reflections on the 5-month turnaround.
Yeah, so 5-month turnaround isn't just asking the questions, it's sort of asking for the topics. So we develop the topics, and that takes a month or 6 weeks. So when people have an idea for a topic, they invite notes of interest and submissions. And we then develop that and agree the topics that go on the panel. Then we then develop the questions, which is quite an iterative process. That takes about 6 weeks. And once we've signed off on the questions, we think they're about right, we then get support from our engagement officers, and they take them out to about 20 or 30 members of the public, so they get user tested, if you like. We then make changes to the questions, and then they go out to the panel, and it takes about 15 weeks then from it going to our research contractor, research resource, to go out to the panel, and then come back with the analysis and the reporting. So it does take a good 5 months or so for each iteration of a survey. So there's only time to do 2, to be honest, in terms of capacity and budget.
Perfect, thank you.
Can I also add to that just very quickly that I guess it's thinking about it in a different context. So there are research companies that maybe run monthly or weekly surveys with people, but it's a very different context and it's a very different reason we're doing this. The panel is about meaningful surveys that really are priority topics that then lead to change and lead to improvement. And it's finding the right topics and bring them to the panel at the right time. It's not necessarily about doing more surveys with people, but doing the right surveys with people.
Thanks, Joy. There's also a question on, is there a plan for a children's citizens panel?
There's no plans for a children's citizens panel.
Okay.
We've never come across that. The panel that we've been asked to produce has been one for adults, and it's representative across the Scottish population.
Okay, thank you. And do you do any follow-up qualitative research?
Specifically in the citizens panel, no. It's something that we may think about doing in future. We've got the capacity to do it, but we haven't done any follow-up qualitative work.
Okay, thank you.
To add to that, I guess follow-up qualitative work or follow-up work in general can be part of recommendations. So if initial findings through the panel suggest that more qualitative work needs to be done, then that can be part of recommendations.
Thanks, Joy. Question for Louise from Gerd. Could Louise extrapolate on where she thinks the outstanding success of the deliberative format might lead in future?
If I understood the question, that would be good.
Gerd, would you like to come on and ask that question?
Sorry, sure. I was just wondering, it seems such a good format, and obviously there's a wealth of different approaches out there. So now that we've hit upon something that is really, really useful and really makes an impact, is there a future of developing it further or broadening it?
Well, sorry, thank you for that. Of course, I do understand you now. I am the biggest fan of Citizens Panel, so I think it's fair to say that with Gary and Joy, we've been doing a lot of work promoting the panel across health and social care policy teams within Scottish Government. That is our remit at the moment. We're not saying no to anyone else. We're always very interested to hear if people would like to perhaps adopt our format, but as a panel at the moment, I think we're doing pretty well in terms of getting it out there, and webinars like this are a perfect example of being able to promote the great work that we actually do here as Citizens Panel. But thanks, Gerd, for your positivity and for thinking that we have hit on something. That's good to know. I agree with you.
Louise, while we've still got you, I think this question from Stephen might be for you. How do you feel about service users not being able to vote on the IJBs, only NHS and council staff?
As a civil servant, I think I probably maybe want to answer that one directly, Stephen, with you off camera. I think that's probably going a wee bit beyond my remit.
That's fine.
I'm also conscious of time as well, because there's a couple of other topics to go through. So
yeah, no worries at all. I'll keep an eye on the chat box as we move forward.
Thank you very much for all those questions there. Yeah, really interesting questions. It's really encouraging again to hear the difference the feedback is making from these. So yeah, we have got another 2 presentations. So without again any further delay, I'd like to introduce our next speakers. So if I can pass on to Murray Steele and Joy Van Vakkeris for our next presentation on COVID programme inclusion, please.
That's great. Thank you, Wendy. So good afternoon again. As I said, my name is Joy Van Vakkeris and I'm a social research analyst in the Community Engagement Directorate. So now I'll be walking you through some of the key findings on COVID-19 vaccination programme inclusion. Next slide, please. So initially, in order to ensure that we could understand respondents' experience of COVID-19 vaccination, we began by asking them about their vaccination status. As shown, the vast majority of the respondents were vaccinated, with 85% having received their first, second, and booster or third vaccination. Just 4% of respondents had not received any COVID-19 vaccinations at the time. And this suggests that most people were able to access the vaccination program and successfully get their vaccine. Next slide, please. The most common method for all COVID vaccine doses was being informed about their COVID-19 vaccination program appointment, through a blue letter in the post, though a range of other ways was used, for example, going through a drop-in vaccination clinic. It is interesting to note that booking through the online portal increased for the third or booster vaccine due to the younger people being signposted to booking via the online portal from the second vaccine onwards. Respondents used a diverse range of information sources to help them decide whether or not to get the COVID-19 vaccine. Advice from senior health officials was most commonly used for this. However, more informal sources of information were also commonly used, such as discussions with family and friends or discussions on media, for example, the TV or radio. With respect to formal NHS information sources, 25% had used the NHS Inform website and 20% had used the COVID-19 vaccination leaflet to help them decide around getting vaccinated. Next slide, please. There were positive findings around COVID-19 vaccination accessibility, with a large majority saying that it was accessible, and that was 89%. And 39% said nothing could be done to make their COVID-19 vaccination more accessible. According to panel members who had been vaccinated, most accessible aspects were venue accessibility features, such as having a quiet room or an accessible bathroom, information on vaccination, location of the vaccination venue, and getting to the venue. The online portal and the National Vaccination Helpline were both seen as easy to use by most respondents who had used them, so 85% and 57% respectively. However, 22% of those who had used the National Vaccination Helpline found it somewhat difficult or very difficult to use, suggesting that it would be helpful to further explore challenges around this and provide improved support for using the helpline. A small percentage of participants noted aspects of COVID-19 vaccination as somewhat accessible or not accessible at all. For example, 5% found the process of vaccination itself, for example, queuing or length of wait, somewhat inaccessible, and 2% said it was not accessible at all. 4% found travel to vaccination venues to be somewhat accessible, and 3% found it not accessible at all. When some suggested areas for improvement, these were around providing vaccination more locally, improved organization at the venue, for example, signage, seating, or less waiting, and an improved online booking system. Next slide, please. As part of this section, we also asked the panel whether they would be comfortable being asked about their ethnicity at COVID-19 vaccination appointments, and it was explained that information about ethnicity is being collected at appointments to help the Scottish Government understand health inequalities. The vast majority of respondents were comfortable about being asked their ethnicity at the point of vaccination, 79%, and 29% understood that this would indeed help improve accessibility and services. Where respondents were neutral or not positive about being asked this information, the most common reasons were given for this were that ethnicity is not relevant to COVID-19 vaccination or healthcare in general, and that was 6%, or that it should only be asked for valid reasons, and that was 4%. Next slide, please. So as a result of the findings on COVID-19 vaccination programme inclusion, we made detailed recommendations for the Scottish Government and delivery partners of future vaccination programmes. There was quite an extensive list of recommendations, and you can read these in detail in the Citizens Panel 9 report. You can find a link to that in the chat. But key points include the following: supporting diverse, flexible delivery processes, providing clear and valued public information, liaising with local authorities, local communities, services and third sector organisations, maintaining a person-centred and flexible approach, ensuring full accessibility of all aspects and information, including accessible routes to request support, continuing to respond to feedback from users, continuing to collect ethnicity data at points of vaccination, and ensuring learning around accessibility is collected, consolidated and shared to shape future policy. These are the key findings on this section, and now let's hear some thoughts from Murray Steele on the context and impact of this work.
Thank you, Joy. If you move along to the next slide, please. Thank you. So for a bit of background information, so I'm from the vaccine inclusion team in the Scottish Government, and the aim of the vaccine inclusion team is really to ensure that vaccination programmes reach every community in Scotland. So we're encouraging uptake, removing barriers to vaccination, and responding to evidence of low uptake. So we work with health boards, Public Health Scotland, and a range of third sector, faith and community groups through our facilitation of the Vaccine Inclusive Steering Group. So that's really a platform to provide feedback, challenge, share ideas, advise on planning, communications, and general delivery issues. So we engaged with the Citizens Panel as it really offered us a chance to widen the sources of feedback that we get. So generally, when we become aware of barriers to uptake, it's through forums like the Vaccine Inclusive Steering Group, which I mentioned there, and a few others which I've noted down on the slide. So we had stakeholder engagement, particularly with our third sector groups, Public Health Scotland, and through health board calls. If you pop to the next slide, please, Joy. So the Citizens Panel really gives a chance to widen this with a mix of quantitative and qualitative evidence. So we wanted to really make sure that we were capturing the successes from the COVID-19 vaccination programme and also the lessons learned. So these can be built in as we're planning for a future vaccination service, or for informing immediate delivery issues, or applying it to other vaccination programmes. So the timing of this was really ideal as we were able to catch a lot of the samples respondents at a time they were going through the programme. So our questions in the panel were primarily around access, which is obviously really key for the representative sample that we spoke to. Next slide, please, Joy. So in terms of the actual findings, the question around information sources and what people trust really chime with other evidence that we have. So we know that individuals from clinical backgrounds tend to have high levels of trust. So remember Jason Leach appearing on the telly. So he still gets rolled out a lot. So from inclusion point of view, Jason Leach has done a lot of things, like he went along to a Q&A for a Polish community group, and we know the Polish community is one which has lower uptake, so we're able to use evidence like we get from the Citizens Panel and knowing that that's a trusted source, and we're able to use individuals like that in the best possible way. So similarly, this Friday, I'm going to an event with the Deputy National Clinical Director, John Harden, and he's going to be talking at a discussion with representatives from African, Caribbean and Black communities. So we really understand the value of these individuals in providing sort of reassuring presence to the communities. In terms of practical experiences, as Joy said, we know they were generally positive, and again, this chimed with other research that we have. We know convenience is a really major determinant of vaccine uptake for people. And we know that local clinics, as the programme progresses, is going to be really important. So in the current winter vaccination programme, there's been a concerted move away from mass vaccination clinics to more local clinics in the community. We are aware with this kind of the survey that from the inclusion point of view, there are some limitations. Because we know smaller groups, like those with long-term conditions or certain ethnic minority communities, for example, might not necessarily come through in this kind of research. So we make sure we supplement it with other bits of research. So recently we did some work with Ipsos Mori, and that was more qualitative work looking specifically at groups with additional barriers to uptake. So having multiple types of research like the Citizens Panel and the Ipsos Mori research covering slightly different things gives us that comprehensive coverage. Next slide, please, Joy. So on ethnicity, so we started collecting ethnicity data last November through the vaccination programme. And that was a really significant milestone for us in helping to understand which communities have lower uptake. It's really improved the accuracy of that data, which PHS publish. At the time, it was kind of in the midst of the Omicron surge, and in the immediate aftermath of it being introduced, we kind of got some feedback from staff that, or from vaccinators, that they weren't necessarily comfortable asking people about ethnicity prior to them having their vaccine. So the findings of the Citizens Panel showed only 8% of respondents said that they might feel a bit uncomfortable being asked their ethnicity at their appointment. That gave us evidence that we could share with workforce colleagues, and really pointing to people that, generally people are very comfortable being asked about their ethnicity these days. It's quite a common thing on forums, and just reassuring workforce around that. Through the qualitative aspect of that question, we also understand more about the reasons why people might feel uncomfortable, and how we can work to mitigate that. So that's all for the vaccine inclusion section. Thanks, but happy to take any questions.
Thank you again, Murray and Joy, for that. Again, extremely useful findings. Great to hear that these have been considered for future vaccination work. Sharon, I'm just going to let you come in with any questions that have been posted during that presentation, or again, if you want to ask a question, if you can raise your virtual hand. Thanks.
Thanks, Wendy. I was just about to say there's been no questions for this section. However, Deborah's just dropped a question in the chat now to say, where can we see the ethnicity questionnaire for this? Is it available?
Sorry.
Yes, please go ahead, Marie.
If you mean the actual question that people are asked at their vaccination appointment, it's taken directly from the census. So from Census 2022, I think the question is just, what is your ethnic group, I think. And then there's a lot of categories that you can respond, or there's a write-in, if that's what you meant, Deborah.
Deborah, can you give us a thumbs up if that answers your question, please?
Just to come in terms of the questions that we asked the panel, and one of the questions was how comfortable they are with being asked their ethnicity. That's in the appendix of the report, if you were asking about that.
Thank you. That was all the questions for this section. Thanks.
Thanks, Sharon, and thanks for responding to that question there. Okay, I'm mindful that we have one last presentation, and so I'm just going to pass the baton right back again to Murray and Joy, and this time we're going to hear about the COVID status certification. Thank you.
That's great. Thank you, Wendy. Can we move to the next slide, please? So COVID status certification is sometimes known as the COVID passport or vaccine passport, and that was part of the Scottish Government package of protective measures aimed at delivering its strategic intent to suppress the virus to a level consistent with alleviating its harms while we recover and rebuild for a better future. A mandatory domestic COVID status certification operated between the 1st of October 2021 and the 28th February 2022. The questions in the survey relate to the use of COVID status certification within Scotland and not to COVID status certification for international travel, as they were separate programmes. It is important to note that restrictions were relaxed in Scotland on 28th of February 2022, so mandatory domestic COVID status certification was no longer required. As this took place during the Citizens Panel 9 fieldwork, some of the findings may be influenced by the fact that mandatory COVID status certification was no longer in operation. These findings highlight the significant positive impact of this work. Respondents were overall happy with COVID status certification, with a majority saying that it made them feel safer when visiting venues. However, it did not influence most people's decision whether or not to get vaccinated, and 79% said that, suggesting that mandatory COVID status certification may not support higher vaccination rates or compliance. Most people were also not concerned about using COVID status certification and did not think that it prevented people from doing what they wanted. Next slide, please. When exploring potential barriers to using COVID status certification, most said nothing would stop them from using it, and 49% said nothing would make them not visit venues requiring certification. Concerns were discussed by a small percentage of respondents, such as concerns over data security, with 9% saying that, 8% saying that they do not go to places that required that certification, and 7% do not support certification in general. However, 33% of respondents said that they had not used COVID status certification at that point, which is important to keep in mind when considering these findings. These concerns mentioned may be based on people's perceptions rather than based on their experience, since 33% hadn't actually used it. Just over 1/4 of respondents, 27%, said that they did not have any concerns about COVID status certification excluding people. When concerns around this were expressed, they were mostly around people potentially not being able to access the technology that was required, for example, the internet, a computer or smartphone, and some mentioned unvaccinated people being potentially excluded, especially those medically exempt. It is important to note, however, that exemption processes were put in place for those who could not be vaccinated. For example, the inclusion of negative testing, and alternative routes were available to access COVID status certification, aiming to mitigate any challenges related to the use of technology. Despite this, these concerns based on people's experiences in practice or perceptions may suggest that the mitigations put in place and the alternative routes provided to use COVID status certification either were not seen as adequate or the participants were unaware of them. This could indicate need for wider and accessible communication about the certification work, alternative routes to use it, and information around data usage and protection. Inclusion of negative tests, which was an alternative to vaccination available from the 6th of December 2021, did not change most people's views on whether they would use COVID status certification, though slightly more said they would be less likely to use it. So this suggests that the inclusion of a negative test led to loss of trust in COVID status certification for some people. The majority of those who had used COVID status certification said they found it easy to use. Ease of use was most commonly linked to digital and online aspects, such as downloading it easily online or using the app. This highlights the importance of continuing the use of digital tools and similar interventions. In contrast, for the few people that found it difficult to use, which was 15%, this was mostly due to challenges with technology, which highlights the importance of continuing to provide non-digital routes to COVID status certification or similar schemes. Next slide, please. As a result of the findings on COVID status certification, and in the eventuality that COVID status certification was under consideration to be reintroduced or a similar scheme developed, we made detailed recommendations to Scottish Government. Again, you can read these all in detail in the Citizens Panel 9 report, but key points include the following. Continuing to use a digital-first approach and providing equal access via non-digital routes and support to users when facing challenges with technology. Ensuring the public has up-to-date and accessible information about COVID status certification, including around the importance and need for it. Ensuring strong engagement with those most likely to be affected by COVID status certification prior to activating it. And continuing to explore public experiences and views around COVID status certification in terms of the positive impacts, challenges, and potential barriers to access. Again, let's hear some thoughts from Murray.
Hi, so for the COVID status certification section, this was work my colleague Danielle undertook with Joy and Gary. Unfortunately, Danielle couldn't be here today, but if there's any questions, she'd be happy to hear from you. So I'll leave an email at the end for you. Just in way of background, so the status certification scheme was part of the Scottish Government's package of protective measures for the pandemic. So the mandatory element came in between the 1st of October 2021 and the 28th of February 2022. Next slide, please, Joy. Yep, so the findings from the Citizens Panel survey are being used to help the Scottish Government's assessment of the impacts of COVID status certification and in informing any future policy. So really it's about adding clarity and greater understanding of how people's attitudes and behaviours towards certification and how that might have interacted with vaccine take-up. So the findings will highlight where people were finding COVID status verification difficult to use and help us make any improvements to similar interventions in the future as part of our ongoing assessment. So that's all from me, Joy. Thanks.
Thank you so much again. Okay, so just before we open up to the plenary session with all of our speakers from today, Sharon, if I can just ask again if there's anything from the chat in respect to what we've just heard from Murray and Joy, or if you feel it may be more relevant for our fuller plenary with all our speakers.
There's just one, Wendy, that's specifically around this particular bit. Has there been learning from this vaccination survey that might impact on the approach taken to inform parents and carers about early childhood vaccination decisions?
Hi. So I think most of the questions regarding access would generally just be applying to COVID vaccination programme. But we will be sharing these results wider, so it could quite possibly, Una.
There's another one just come in for yourself, Murray, I think. Was there any request for a national expert advice line for those with specific issues regarding the COVID vaccine?
Sorry, is that around a phone number?
I presume so, a national expert advice line. So it could be, I don't know whether Una wants to come on and ask the question herself.
So there is the national helpline, which organised appointments for people. But in terms of actually offering advice, I'm not too sure.
Thank you.
Can I just quickly come in on this? Thank you, Sharon, and just say that there was no findings, or when people were asked what would make it easier for them, there was no real findings around an extra helpline or kind of what you just mentioned about further expert advice. So based on there being no findings on this in this piece of work, there was no recommendations on this either.
Thank you for that. Okay, just before we open up, I noticed Deborah's response earlier in the chat box to the reply to a question about I think it was the ethnicity questionnaire. Deborah, very mindful of time at the moment, but if there's anything that you need clarification on, I know that you're within Healthcare Improvement Scotland, please feel free to add it to the chat, and I'm sure Gary or Joy can respond to that afterwards. Okay, we have another 2 slides now. Joy, I'm not sure if you wanted to come in at this point or if we want to open it up to all speakers to come back on the screen for the plenary session, if we can do that just now, and then cover the last 2 slides.
That was very briefly to say that as part of this work, we asked his panel members about their views and experience on the panel, and we got really positive feedback. Many members said that it gives them a voice and they feel that their contribution is worthwhile. But some also mentioned they were unsure how the findings influenced policy. And the next slide highlights just some timelines in terms of what's coming next for the Citizens Panel, with our next report, Citizens Panel 10, being published in November. So that's all. Thank you.
Fantastic. Thank you, Joy. Okay, if I can ask all speakers to come back on the screen. Thank you very much. That was really insightful overall. And just to find out if there's any other questions, Sharon, in the chat that we can pick up on.
Yeah, I've got 2 general questions. So the first one from Nicola. Has there been any overlap in topics or participants with public partners in the NHS boards and or the patient experience team? She's just wondering if it would be positive to cross-reference views between these involvement methods.
Maybe I'll just answer that. So when we develop the questions with the topics, we look at previous either research or engagement from across that topic area. So we have done in the past, and one we're doing similar sort of thing to just now is in our current one, Citizens Panel 10 on community eye care. We're cross-referencing some of the results with the Scottish Health Survey, which is a big survey on health, and obviously specifically looking at community eye care. So we do cross-reference between other pieces of work just to maintain the context and make sure we don't duplicate work as well.
Thanks, Gary. And another one from Una asking, how does this participation activity interlink with care opinion that seems to duplicate some of the demands on the public to provide their views on healthcare?
I suppose I'll answer that again. There's no link between care opinion. So care opinion is an online feedback portal, which I think most NHS boards in Scotland use. And that's feedback from patients specifically, or service users who have experienced care. So our citizens panel is specifically the general public, not people with lived experience per se. So they are two separate pieces of work. Some of the issues might overlap, I would grant you that, but the topics and the questions are very more specific with the citizens panel.
Thanks, Gary. That's everything from the chat box, Wendy.
Okay, thank you. Okay, we're almost at time for the closing of today's webinar. So I'm just going to take the last few minutes to say thank you so much for joining us today. And of course, a big thanks to our presenters and to Stu, Sharon and Linda, our support team. The presentation slides and the recording, I think that's already been said within the chat, that will be shared on our website. And you will also see that a link to a short feedback forum will be posted in the chat box as if by magic. If you can please take the time to complete that, it really helps us identify what's working well and make any improvements to future sessions. And of course, would also really welcome your thoughts and suggestions for any future topics within the feedback forum. And before closing today's webinar, if I can just do a shameless plug, that our next webinar will be held on the 9th of November. It will focus on community engagement. What if we centre or prioritise disabled people? So that promises to be yet another engaging webinar, and you'll find all of the information relating to that in the chat box. So if there's nothing else, all that's left to say is thanks again to everyone for joining us today, and hope you all have a good rest of week. Thank you.
Thanks everybody. Cheers.
Thank you.